Welcome to this episode of the RiVeR Project's podcast series. I'm delighted to be here today with Dr. Michelle Walsh and Lisa Brown. Michelle is the CEO of Move Ireland and Lisa is the Director of Client Services. So I might just start with you, Lisa, and ask you to tell us a little bit about your role with Move Ireland.
Thanks, Lisa. So my role in Move Ireland, Move Ireland have 12 programmes nationwide, and we run the National Perpetrator Intervention Programme called Choices. And my role would be overseeing the day-to-day operation. We have 4 managers in place who directly manage the 12 groups that we have nationwide.
Very good, that's great. And Michelle, ask you now about your role as CEO.
So basically my role is to oversee what Lisa does in terms of the development of the programme, but to also see oversee the growth and the development of the organisation and where we go. So really I'm one of those people who has fingers in everybody's pies. And my job is to see that we're all following a plan and we're all going in the one direction. So basically, I suppose, as a CEO, that's kind of what I do. Yeah.
Great. Yeah.
Job of what is it they call it? Master of I don't know. Job of all trades and master of none, or something to that effect. But yeah, that's basically
the leader of the ship. We'd say.
Yeah.
Absolutely. Yeah. I know good CEOs are able to move from one thing to another at any given moment.
Yeah.
Mm-hmm.
So we're here to talk about Move Ireland today. So would you mind telling me a little bit more about Move Ireland, and just maybe keep in mind that those that are going to maybe listen to this podcast, this might be the first time they've heard about Move Ireland, whereas I've been a long-standing fan.
So if I say a little bit about what Move Ireland is, and then maybe you can talk about the actual programme, we'd probably be better.
Yeah.
Because we'd both be talking to our... So Move Ireland is it's a national perpetrator programme. We're funded by the Department of Justice, now CUAN. So we work predominantly with perpetrators of domestic, sexual and gender-based violence, domestic violence predominantly. So I suppose Move as an organisation, I took over as the CEO last year, just over a year ago. So we're a national organisation. We have our head office in Clonmel and this office here in Dublin. We have about 13 full-time staff. We have about 60 facilitators. We have regional managers in all of the major areas, Dublin, Mayo, in the Midlands, and where am I missing? Southwest, yeah. So Southwest is, yeah. So we have 3 programmes running in each area, and within that then we have a dedicated manager that works under Lisa, and then under them we have the dedicated domestic violence support team, and then we have the facilitators. We have 3 facilitators that will work with each programme, work on each programme that we roll out. We interact, I suppose, an awful lot with the Department of Justice, with probation, TUSLA, and then I suppose an awful lot of our referrals would also come from community. So, yeah, I think that's about, we would sit on a lot of local and national steering committees. I'd say that's about, Am I missing anything? Yeah, there you go. So, over to you for choices.
And then, as the Choices programme, we run in 12 areas nationwide, and most recently this year we went online to meet demands, especially in rural areas. All of our groups are in the evening. They're free to attend. It's to reduce as many barriers as possible for people to attend. It's a domestic abuse, we call it a prevention programme, to hope to prevent future incidents and keep families and women and children safe at home. If anybody wanted to refer, if they were a self-referral, and actually about 55% of our clients are self-referrals. It runs about 38 are probation, so they're court mandated or court conditioned to come, and then TUSLA and then addiction mental health services will make up the rest. Our regional manager meets every referral that comes in. We try and meet them in person when we can, to explain about the programme, what the programme entails. It's a long, intensive programme, so it's really a commitment to attending. which it then shows a commitment to really wanting to change your behaviour. There's about 33 sessions in total to attend. The Choices programme itself is 23 weeks long, and it goes into different aspects of healthy relationships. We discuss things like gender or sexual abuse, emotional intimacy, where that will cover like jealousy, things like that, support and trust, to be able to trust your partner, and parenting. But the parenting is not only about how you yourself are a parent, so it's not a block to attend if people don't have children, because a lot of it goes into how people themselves are parented. And we do see, when we do it's a comprehensive assessment, we would do with a man coming on and his partner, people have come from a lot of trauma. There's a lot of intergenerational violence throughout when you go back like genealogy with them, and a lot of people have come through a lot of trauma as children. So having to sit in a programme and even see how they themselves were parented as a child, it can be quite tough. It's a tough programme for people who want to attend, but the outcomes are fantastic for people that do attend. I was just looking at evaluations the other day because we're doing our annual report, and even the amount of men that said like everything changed. It wasn't just their relationship at home with their partner or their children, their relationships in work. So there was a lot that was lifted that they were able to work through, which is fantastic.
Yeah, that sounds really good. Very comprehensive.
Yeah.
I think, you can't work, like we've both come from victim services. Like my background is rape crisis, Lisa's is GV and refuge services. And I suppose predominantly, even for me, one of the reasons to make this jump is everybody knows a survivor. And for the amount of survivors that we have and the increasing amount of people that are reporting, there is a perpetrator behind that. So if we don't address that piece, and if we don't work with the perpetrators, I used to say, and this is an awful expression, but when I worked, because I worked on the front line as a therapist, a supervisor and a researcher, and consistently all you're doing is you're downstream pulling people out of a river. And unless we actually start to tackle and work with perpetrators and broaden out what we do with perpetrators, we're never going to make any serious roads into actually tackling domestic sexual and gender-based violence. And I looked at it like my own research I created an ecological framework for understanding and responding to sexual violence. And like you're looking at the individual, the interpersonal, the community, the society piece. And like it strikes me that we have a lot of punitive laws, we have a lot of structures within society, but that individual piece is very, very important. And like somebody has to champion actually doing that and reforming a person. And like what strikes me an awful lot as well is like you can do that. Like we have great initiatives in education that are coming forward. Kuan now are giving us all a focal point and kind of drag all the services together. But like you can educate a boy, you can educate a man, you can educate a child, and that's brilliant. They can get all the education around consent and don't engage in violent behaviour. And then they leave that interpersonal bubble where they where they live with their mum and their dad. And then they go into the community and the interpersonal relationships with their friends. And suddenly society starts to undo all that's been done. I say it consistently. I had a very good education, and recently, like my young fella's 27, and he grew up in a house where I trained to be a therapist at 40. So everything was like consent, no violence, education, the whole way along, to the point it was like, don't psychobabble me, mammy, anymore. And one of my kids turned around and showed me an Andrew Tate video about a week ago, and he thought this was really, really funny. And I couldn't believe that he was actually watching this after all of the education and the time and the effort that I'd put into him. But what dawned on me was, and you know what, Gail Dines says it, I don't know if you've ever looked at Gail Dines' stuff around pornography, that society does the grooming for us. It actually does. Because literally when he went out into community, and when he started to mix with his peers, and when he wanted to be socially accepted by his peers, he went with the general consensus. You know, and funnily, I went home that evening and I spoke to his girlfriend. And she's a teacher. And she's going, I think Andrew Tate's really funny. I never really thought about it. And and I went, hang on a second. If one of the, she's an SNA, right? She teaches in a secondary school, STEM teaching or something to that effect. I went, if one of the 14-year-old boys in your classroom said some of the things that Andrew Tate is saying in this video, how would you feel about it? And she was like, I never even thought about it.
Yeah, so it's very interesting that wasn't a thought among people who have had great opportunity to understand it at a deeper level and have possibly even had that in their own training themselves. And do you think that now I might be going a little bit off there, but do you think maybe people get the connection between that area of focus and the work that you're doing? The connection there between, you know, between the perceptions and the positioning of...
I don't necessarily think they do. Like we were in Coon this morning, we were listening to the new organisation and, you know, listening to all of these great initiatives, and they are all brilliant, absolutely all brilliant. But you know, we're so focused on victims and victims coming forwards and what's going to happen with the perpetrator. But I don't know if we're actually focused enough on how are we helping the people that are stuck in society, that are stuck in ways of thinking and being, that are leading them down paths. And, you know, I often say, like, there for the grace of God go I. You know, and what is it? Like, it's a split-second decision between, and more often than not even a conscious decision. When you're triggered and you're in a relationship and something happens between somebody that ends up on a program or somebody that ends up perpetrating something and somebody that makes another choice. And I just don't think we do enough. I think we're not, like, it's fantastic that we have these initiatives and supports for survivors, and every single one of them is needed. But we also need to broaden out. And I don't mean to condone, but I think we need to make it okay for people who recognise that their behaviour is actually impeding on their lives, for them to be able to get past that stigma and shame and to be able to come forward for help. Like, one of the big parts that we within our programme, you know, we won't accept somebody on the programme. So we don't just, you can't just rock up to us and go, probation said I have to go to do a programme, and I'm just sitting here in my bum in the seat for the crack of it, because we will tell you thanks very much and go home. So we have to get people that have a certain amount of acceptance of what they've done before we will allow them onto the programme, and we will keep them on the programme. That's a challenge in itself, because then we get situations where people come from probation and they'll admit what they've done with their probation officer because they know already, so that barrier to breaking it down is fine. And then they'll come onto a programme with us, and then it's a new person and they can't admit it. Like, why do we lie? We lie to protect ourselves, protect the people we love. We do it for a reason. So they'll automatically put that barrier up and they'll go, I only did it because, and then they're gone. So then, like, we've started to work with probation recently to develop what we call a step-up programme, where we can help probation to get people, the probation officers, to get somebody ready to come on to a programme that they can get past that stigma and shame. But then, like, it's a behaviour change intervention programme. It's the length of it is needed. And we'll get somebody through a programme. And what we've actually discovered, because we started piloting pre-counselling, post-counselling with survivors or with perpetrators of domestic violence, what we found is when you get to the other side, what you have is somebody who's completely able to sit and accept and talk about what they've done. But inherently, they're still carrying that stigma and shame. And stigma and shame, unless you address them at their core, will manifest when you re-enter into society. So what's going to happen? You're going to go back into society. You have no supports. You have no place to go. So what are you going to do? If you haven't got something that's going to, you're going to reoffend. The capacity for you to reoffend is really, really increased. So what we have piloted and done along with probation and one of our area managers is we've kind of done a group intervention, or we've done a one-to-one intervention with men that have come through the programme to look at the issues, that deep-seated shame and guilt, to help them to make better choices and reintegrate them into their families and society at the other end. But this is one of the problems for us. Like Choices programme, it's a fantastic programme. Like it's 6 modules. Every module has a different focus on content. Once you finish the module, you're working. We have the partner contact worker there for the person that has a partner. We have the facilitators, they're both getting jointly assessed. We're doing pre, post, mid valuations. We're doing a risk assessment at the end of every module where we're bringing the partner contact worker and the manager together and the facilitators to really, really navigate any risk or help maybe get somebody out into probation or get somebody out into refuge or whatever we need to do. But that's just not enough, because a group intervention on its own is a one-size-fits-all. It isn't a one-size-fits-all. And then you've got like female perpetrators, you've got same-sex perpetrators, and these people are coming forward in community. At the moment we're working with same-sex couples, and we actually had a female going, look, can you actually do anything for me? Because there's no place for me to go to get help. And that's just the tip of the iceberg before we actually started to look at people within travelling and ethnic minority communities, where the stigma and the shame and the barriers to coming forward and admitting what you've done and even admitting it to yourself. Like there's huge scope for the work that we can do.
I think in terms of the work we do at the moment, if you had a victim come to you and say, I'm in a violent relationship, your first thought is leave. You know, that way. So I think there's a natural fear as well from some people, instead of going, maybe he could go to a perpetrator programme, because there's also that running thought in the background, but what if it actually got worse while he was waiting to come on or while he was on? So there is a little bit of element of fear. That's why our evaluation on the programme is going to be vital now next year, to be able to do that.
And like to have something that has been evaluated in an Irish context, because we do lean a lot internationally on evaluations. And as we know, evaluations in this area are kind of undermined at times by different methodologies and things like that. But I mean, to have something that's actually happening in an Irish context, and to be able to already see the areas that you want to move towards, because I mean, I think that's a fantastic description, Michelle, about, and as comprehensive as the programme sounds, but there are many things that mediate people's experiences that we know of, and we do need to attend to them, don't we?
Yeah. I've been auditing stats now over the last couple of weeks, and even in terms of the women that engage with us, like I suppose we've often talked about this, we're in a bit of a unique situation in terms of, like, from my own previous experience in refuge work, but we're all working with clients that are still living together and putting safety plans together for people who are still living together. The stats when I done the percentage last night, 74% of them women had never linked in with a domestic violence service before. That's a huge cohort of people living at home with no supports, and children there as well.
Yeah, I mean, it's a wonderful thing because you had mentioned the partner support as well, but I mean, because when we spoke before, we talked about good practice and guidance and things like that, and having that connection with partners, which I think is important for our listeners to understand as well.
We were talking about our Dublin partner contact worker now during the week, Martina, and the way Choices was kind of designed before, women were referred when we knew men were coming onto the programme, whereas we piloted it this summer, so we were referring at the same time. So the regional manager met a man, he's suitable for assessment for a group, and at the exact same time we were referring her to our domestic abuse service as well. So the two of them are being assessed at the exact same time, you're getting the gauge of level of honesty, what exactly is going on in the relationship. We're asking adverse childhood experiences, so you can nearly signpost it, by looking at the adverse childhood experiences, who you need to signpost to get additional supports, or if supports are needed prior to bringing somebody onto a group, because we do have a duty of care to everybody we bring on. And the most crisis work now being done with the women is before the man comes onto the programme, which is we're going to talk about it's very interesting. Like going for court orders, people leaving, going to the Garda station to give statement, things like that have been the things that have been happening during the summer. And by the time the man comes onto the programme, that's almost plateaued, and it's levelled off. So it shows even where that man at that stage, he hasn't been given tools to be able to react appropriately or take a time out or go for a walk. He's still in that reactive state at home. And she's in danger, and she's acting on that danger and getting the right supports to keep her and her children safe, which is vital. Yeah. And then when that work is being done with him, following 5-6 appointments, by the time he gets to group, you can really see the benefit of the work after being done with him. She's in a safer place. It's not crisis work, it's support. Yeah. Which is quite interesting. Now, it's only very pilot, so we don't have, we didn't even properly evaluate it. It's just we were having a conversation about the clients we have in Dublin at the moment.
And you see, I think you always have the extremes. You'll always have the really, really violent people, and you'll go, why don't they just leave? Okay? But the reality of it is, and this, you've worked in refuge for a long, long time. Most people that live with somebody that's violent, it takes an awful lot for them to actually give up on that relationship and leave.
Yeah.
Absolutely, not to mention how dangerous it can be for some.
Yeah.
But under the Domestic Violence Act, in a domestic violence order, it can be stipulated in court by the judge he should go to a perpetrator programme. That doesn't happen.
Okay, that's very interesting.
Yeah, we get them on a breach, that way. Yeah. So, even if that was done at the initial stages, the amount of supports that could be put in place for the family.
Because that's just, in thinking about what you've mentioned there, it sounds really proactive.
Yeah.
And would it be fair to say a move away from the more traditional partner support, which essentially was about checking in?
Yeah.
It wasn't necessarily about creating a support plan or anything like that, or doing work. It was more about are things going as well as we think they're going or not, or which again, it serves it's
purpose.
Important, it's really important. But that sounds quite balanced in terms of the support as well, which that seems kind of new and very innovative.
We always had it, but it was, as I said, it was at group stage, and then when, as Michelle was talking about, we have a risk management and we talk about every case individually at risk management. And we would get feedback. So you'd get feedback about how the man is coming in group, how he's getting on. And you'll get feedback from partner contact of the buzzwords that are coming from group, that he's taking the time out. We want to make sure that's being done appropriately. Does he need additional support to walk through that? And you can see the growth and progress of the man coming through the programme when we link in with the partner as well. It's about 44-45% of partners will link in with us. So it's it's an okay number.
Yeah, it's
an okay number.
Positive now. Yeah. Obviously, there's a lot of groundwork that needs to be done before the recruitment, which you've obviously been very, very successful at.
Yeah.
Do you mind if I just through I suppose from the perspective of somebody listening that is considering making contact with yourselves, or a professional that's thinking about referring, can you talk us through maybe that journey for a man, say? You had mentioned, and you touched on the assessment, you touched the length of the programme thing and the modules and stuff, but would you mind just maybe giving us a bit more?
To refer in, I get a lot of phone calls here in the office, and it might not be named as abuse in the beginning. I'm very angry. I need an anger management programme. And not only from men that ring, I would be asked this question by professionals a lot for anger management. And I just say, is that person's anger being taken out on his family? Is it affecting his relationship with his partner? Is it affecting his relationship with his children? Ask them to pick up the phone. We're always at the other end of the phone. On our website, we have an online referral form. You can fill in information that way. There's a request to call button if people don't want to fill in, they just want to be a bit curious and ask a few questions. We'll give you a call back then. And what I say at the very beginning stage is, don't be looking at this going, there's 33 sessions to attend. Look at it that there's one. come and talk to us. We'll talk to you about the programme. The assessment as well, it's to see if he's suitable for group, but you have to see if the group is suitable for him, because it might not be.
Yeah.
There might not be an established pattern of abuse. There might not be an acknowledgement of behaviour that's abusive at home. All things that you need to be able to work on that and recognising behaviours of being abusive. We work on that then when the man comes in.
I think there's a subtlety to the work that's quite different, because you actually have to get somebody to take accountability, but you have to build a relationship to do that first.
Yeah.
Like if I turn around to you and go, well, you robbed my purse, you're going to go, no, I didn't. Even if you did, and not for a minute that you would.
I might tell the truth and say I did.
Yeah, but like, you know, the same is true. Like you asked somebody to talk about the worst incident that they've done, and if you're not in some way warm and empathetic, you're never going to get that. So there's a balance between accountability and building a relationship with somebody, so you can get them or allow them to feel safe enough to open up. And there's a definite skill in it. There's also a very, very big skill in the work that we do, in terms of making sure that you're not colluding, that you're not being, like, you know, I love the Darvio model.
Oh, yes, yeah.
So in looking at what somebody is doing and seeing, are you being manipulated? Because it's very, and a lot of the people that we would work with would, you know, on the higher end of the spectrum would be quite manipulative. They would have, you know, they would have you wrapped around their little fingers. So I suppose as well, like, we build in an awful lot of fail-safes. It's very labour-intensive work. Very, very labour-intensive work. And there's a lot of, like, at the end of every one of our modules, that's why there's risk management. At the end of every one of them, there's also peer practice. So when our sessions are happening, the facilitators are being recorded. And that's then being viewed by a peer practice supervisor. And they're looking at the facilitation styles. They're making sure that both of the facilitators are, you know, one of them isn't talking over the other, that they're being respectful, that we're modelling the behaviour that we want to see people adapt the whole time. Then as well, there's the element of clinical supervision at the end of every module. So we're really kind of, you know, I suppose you could be very easily taken in. So there's a skill in what we do.
Sure,
Yeah.
Absolutely, because, you know, from what you've mentioned there, and the very positive feedback, and behind every person that you work with will be those families, and, you know, not no pressure, but, you know, in the work that I suppose we've done together, whether it's with perpetrators of abuse or victim survivors, it's really privileged but risky work, because there's an awful lot
of protocols that we would put in place in terms of, like, even when how a group is run, where the group is run, how many people are present, you know, all of those things. Even for the online groups, there's a lot of thought that has to go into safety.
And that safety is a ripple effect for everybody. Like, for example, we look at videos. The online group, we naturally don't do role plays, but we do role plays in community groups. So we were getting good videos to put them up to be able to show, and then have that open discussion with the men afterwards. We would audit every video, because if something is too triggering, and a man is very early in the programme, and he's with us for 2 hours in an evening, then the programme is logged off. If he's not able to manage his emotions,
of course.
so we would
sending them home,
we'd often say, look, it's kind of a bit of a mantra. We have a duty of care to everybody in that room. So not only the facilitators that are present, to the men that are present, to their partners and their children after that group and coming to group. So there's a huge duty of care to everybody that's in that.
Yeah.
But it's really, like, it's really positive work. And when we see the evaluations, and I sit at risk management, I love sitting at risk management to see the facilitators, but you hear the growth when the domestic abuse support worker is giving you feedback of things going well, when the men are ringing saying, my kids are now living at home, they're not in foster care, my supervised access is lifted, because they've put the work in. Like, we were coming on this podcast this afternoon and thinking, going, oh my gosh, what are we going to say? People are going to judge us, right? Imagine I asked you to sit in a room with 8 other men and tell me your worst thing you have ever done.
Yeah.
Or just sit in front of somebody that you've never met and take responsibility for abusive behaviour. I mean, you know, that takes, as Michelle's beautifully described. That means that takes huge preparation and a very empathetic and supportive environment in which to do that successfully.
For the man to do that, it shows his willingness to want to change, to lay it bare and never go there again. And this is what we hear back at risk managements all the time, which is fantastic.
And like when you think about it, we have nearly half of our clientele that are people who are picking up the phone and going, I need help.
Yeah.
I need help. So as much, and we're only tipping the iceberg in terms of, if you look at domestic violence services and what's available and what people know in terms of what's there for victim support, a lot of people don't even know what we do or how we do it or that we exist.
See, that's why things like this are so important.
Yeah.
Because I would think some people know about domestic violence services, probably more people know about domestic violence services, but it's amazing that they know so little about it and sometimes it doesn't help when the perception about perpetrator programs or the perception about victim survivor services is inaccurate. So, that's, I suppose, a big part of these podcasts is about creating that awareness as well. Because when people are aware, it's in their thoughts to refer, it's also in their thoughts to self-refer if needs be. It takes some of the mystery out of it, but also maybe hopefully some of the fear as well. Yeah,
and we do that. Like, you pick up the phone on any given day, and if we can talk a man through putting in an online referral, if we can literally type in the stuff and send the referral form, we will do it, We try and support in whatever way we possibly can.
But it's a step when he's actually putting the number in the phone and ringing. And sometimes his partner is getting a little bit more information to give to him. And there's an ultimatum at home for him to call. And that's fantastic.
We also won't accept anyone onto the programme unless they give us their partner's details. It's part of the protocol.
Yeah. And when they're in the room, it's her first name, so everybody's very real in that room. We've started tracking it this year. It'll probably be now next year when we get it. There has to be motivators behind that. So we're actually now it's this year we're collating the information of what are the motivators behind an actual self-referral, because you were told to an agency recommended it, or is it your partner recommended it, or I've actually had a man who went to work and was upset in work and said, my wife is going to leave me. And the man that was sitting across from him said, you know what, that was me 2 years ago and I don't move.
Wow.
Isn't that?
Yeah, that's brilliant.
Isn't that fantastic?
That's brilliant on so many levels.
Yeah.
That he was in that space at that time, but that somebody was brave enough to also say, I was that person and I did a programme. So I mean, taking what you spoke about earlier about the stigma and taking that away obviously makes huge sense for it to travel for people to understand.
But even like with the ACEs and stuff that you've been tracking, like the average, we're like most of the men in our programme are tracking about 13, 14.
Yeah, they're all 10 plus.
Yeah. So there's huge trauma, shame, and again I think there's a huge piece of work around how do we socialise men in this country.
But then educate them as well, because the men, how we done that originally is we used to ask, did you experience domestic violence as a child? And like a lot of our men would say, yeah, my dad was abusive. We do get that a lot. So did you experience trauma as a child? Jesus, no, I had a grand childhood. So we need to educate these men that this actually is trauma. This is going to affect you as an adult and as a father. And we need to put in something that your children aren't going through this. To stop that, the intergenerational abuse.
I mean, I even see it with teenagers and I wonder where we're going to end up. I think that there's a huge need there. Like we would often get referrals or requests for, to work with 16, 17-year-olds. We're not equipped, we're not funded to do it at the moment. We don't have the space or the capacity, but it's something that's so, so needed.
I know I say that makes sense a lot during this podcast, but all of it makes a whole pile of sense. I mean, we don't want to be in the place where we continue to have to respond and firefight, and that proactive kind of work is.
And it's really that piece around ecologically looking at, okay, what supports have we got for survivors, but what supports have we got for perpetrators as well. Like we're working in the prison service. We started to work. They've asked us to to develop and come in and train them and do some programs. We're starting to assess people, but it's only the tip of the iceberg. And this is a lot of new work and new initiatives that we've taken on this year. But there's so much more to do. So much more to do.
And if you were to be looking at the whole iceberg now, blue sky, where would you go with it?
Where would I go?
So specifically working with those who
perpetrate.
Yeah.
So I would, blue sky thinking for me would be a program, an accessible program in every county, online programs, but then also I would like, say for looking at the domestic violence support team, I would like programs for the women on those that they're supporting to help them, to educate them and just up their level of skills around domestic violence and just life in general, because a lot of them are coming from a low socioeconomic background, just to give them life skills to be able to integrate better into society. Things like how to vote, all of those kind of little bits. I'd love to do that for the women. For the men and for perpetrators in general, to continue to have aftercare groups, to have one-to-one groups, to have same-sex groups, to be able to work more with sexual perpetrators. You know, I suppose cater really to the communities that we're not even getting to touch, to work with teenagers, to work in prisons. That would be, and I like to take what we're doing and to upscale it. The only thing that's stopping it is funding.
Yeah. I want to say, considering what this issue costs, not just our economy, but every economy, it sounds like a really good investment.
If you look at, you know, and I suppose, you know, maybe I shouldn't be saying this on a podcast, but if you look at what we're going to spend, like you look at Nata Dervy's stuff from NUI, and you look at the cost of domestic violence in a year in the Irish context.
That's another podcast.
That's another podcast, yeah, definitely.
And my blue sky, I don't think my blue sky, I think it actually could be a reality. A 5-year longitudinal study on the effectiveness of perpetrators in Ireland, or programs in Ireland. We have the women, we have the men, we have the data.
Yeah. Oh, data's key.
We have it.
Data is key. Oh, that's right.
Yeah.
I've probably kept you long enough now at this stage, but I do have just a couple of wee more questions. You had mentioned education, Michelle, so we might come to that if you don't mind. And just on a very practical level as well. Now, you've mentioned about men contacting the service, and the ways in which they can do that. Now, I'd imagine you work quite closely with the other agencies. You've mentioned them a fair bit. Now, I'm just taking a guess at this, but I would imagine that any agency could contact you as well to talk it over.
Yeah,
absolutely.
They were thinking about referring somebody, just so that they would have, but you know yourself, sometimes if you don't know enough about something, you don't have the confidence then to talk about it to somebody else, whereas people can get the exact information.
And if they want more information, if agency wants to pick up the phone, and I invite myself everywhere for a cup of tea, I really do. So we'll come, we'll meet your team, we'll tell you what we're about, put a face to the name on the end of the phone. I think in this sector anyway, it's all about collaboration, it's all about working relationships, and how we can both support each other in that, because obviously they have a family that they're worried about. We have a programme that they could do and we could support that family, so how do we do it together?
And I suppose that's the beauty behind having the 4 area managers as well, and the DV support team, is that they can integrate more appropriately into the community that they're based in. So local area networks, the SIPCs, all of those initiatives that are happening within community, that they can actually link in on the ground and get people knowing what we're doing and what we're about. And they're all more than happy to come along and have a chat. You know, really are. And apart from education, like what I suppose coming back to the education part, we do run a training for our facilitators. So they do a level 8 special purpose award, on working with perpetrators of domestic violence. It's a free training. We put out calls. I think the next one is coming in probably January, December, January. Yeah, to start in March. So yeah, and then
I don't know if that's out there yet. That it's common knowledge.
No.
So.
Yeah, and obviously as well, like I had a probation officer down in Clare ask me, how could I volunteer to work in your program? And I went, actually, if you came and did the training, and it's not an onerous training, there's like 2 weekends, and I think there's 10 or 12 online sessions and a couple of assessments at the end of it. But if you did it, we'd actually pay you to do the work. Win-win. Yeah.
Very good. Yeah. No, that's great, because I mean that's a wonderful opportunity for people to hone their skills in what is a very skilled area.
Yeah.
You have to be on your game for this, don't
Yeah.
you?
Yeah.
So now, very practically, just what is your website, and what can you give us your contact details so that anybody listening?
Oh, www.moveireland.ie, and we're on social, so we're on X, Instagram, Facebook, LinkedIn. Yeah.
You get both of us on LinkedIn if you want to send us a private message. Otherwise, the phone numbers are on the website.
Yeah. We're like a bad penny. We'll turn up anywhere.
Very good. So just before we finish off today, is there anything that you didn't get a chance to say before we finish up?
I don't think so.
No.
Thanks for having
You're
us.
already thinking about part 2, podcast number 2.
Yeah, just thanks for having us.
No, thank you. On behalf of the RiVeR project, it's wonderful to hear that, and I know that this is going to really help people to understand your work at a deeper level. You know, and that's really important. And this will reach. Our hope is that this will reach the people that need to hear it. So thank you. It's been
You're very welcome.
Absolute pleasure.
Thank you.
Thank you for joining us for this episode today. We hope you will join us for the rest of our series, the RiVeR Project podcast series. Until then, take care. Thank you.